Hey everyone, thanks so much for joining me on another episode of the podcast. I'm excited to meet up with two people I met at the health conference. First time I was meeting you, Aneesh. I've met Tatiana a few times, actually met for the first time at the health conference. So we have to give our shout out to health since they were so nice to have us there. But really excited to dive into this partnership that we recently posted a clip about that you two put together. For anyone in the audience, we'll let you do intros in a second, but Aneesh is over at CareJourney, Tatiana's at Koda Health, and I think a great way to start off is we'd love for each of you to dive into a quick overview of your background, and we'll talk more about this partnership.
Tatiana, you want to go first?
Sure, I'll dive in. So my name is Tatiana. I'm the co-founder and CEO here at Koda Health, and Koda builds tools that simplify a lot of the more difficult conversations in healthcare. And specifically, our flagship product is around advanced care planning. So we've developed this single source solution that helps patients explore their values, identify a medical decision maker, figure out what their quality of life and treatment preferences are. And in doing so, we automatically create all of the legal documents that protect their care, like advance directives, medical power of attorney, et cetera, that really just streamline the whole process, integrate with everyone they need to integrate with, and make sure people at the end of life or in a crisis can get the care that they want.
Yeah, and Jared, you could imagine I'm excited about the work that Tatiana is doing. Aneesh Chopra, I founded and am president of CareJourney. Today, we are an open data membership program, and we largely focus on organizations that are moving to value-based care with an emphasis on what constitutes high value and where there are challenges and opportunities for improvement across physicians, networks, and across different patient segments. The principle of the company and the reason why I'm motivated with the partnership is that I had almost a decade-long career in the public sector. I was in state government, was in the federal government, and I care deeply about public-private collaboration. So where can we solve big problems together? And CareJourney in many ways is an extension of my time in government, where we've been able to open up more data. Where I get excited about the introduction to today with Tatiana is we're able to shine light on whether or not the country has taken advantage of all of these new capabilities, including promoting more of these more complex and difficult conversations so that we get the best possible care tailored to our individual needs. And I want to shine light on where it's working and where we can make improvement.
Absolutely.
Thank you both for sharing. So I really appreciate no one ran into a wall or anything, right, during our walking and talking little clip that we put together at Health. Apparently, I almost tripped on a couple things, but that's bound to happen. So that's not a big issue. Can we dive in? I would love each person's take. I know you gave us a little snippet of what the partnership means to each of you. I know you talk a little bit about Aneesh, the excitement around working with Koda Health. I know Tatiana said the excitement around working with CareJourney. I guess if possible, I'd love to get more into the meat of the partnership, what this means in the short term and what this could mean in the long term for both organizations and for patients.
Maybe, Tatiana, I'll take this first stab because I may set the stage. CareJourney has a research license atop the CMS database, which includes the Medicare fee-for-service patients, the Medicare Advantage encounters, and the Medicaid encounters. There's about 145 million linked longitudinal claims, and there are stories to be told. And my team was only scratching the surface on what stories we can tell about what works and what doesn't. We approach and engage organizations like Koda who can help us understand what seems to be better performance versus others in areas that we may not be as focused on. So advanced care planning has been a longstanding policy interest of mine. My mentor is Senator Mark Warner. This is an area that he's pushed Congress to put into production. And I'm observing that it doesn't get that much adoption, but I don't have as much detail as to the challenges and opportunities. By having a partnership with Koda, I'm getting smarter about what the challenges and opportunities are, and they're guiding us to understand in the public data what constitutes better performance for a physician practice or an ACO network. So for us, it's about developing a better benchmark that we can make available to every one of our members, whether they choose to work with Coda or not. To be blunt, it's about broad industry understanding. And then I hope, based on the nature of the information that we're sharing and best practices, we might foster more in-depth relationships to track the results of these programs and maybe to highlight more best practices. So Tatiana, that's how I see it. Happy to get your take.
Yeah, no, absolutely. I think to that point, an improvement in the metrics and an understanding behind that benchmarking data, behind end-of-life care and outcomes. Frankly, if we can improve those components, a rising tide raises all boats or raises all ships, right? The fact of the matter is that advanced care planning adoption, despite new initiatives from CMS, new reimbursement codes, CPT codes, performance metrics, continues to stay in the single digits nationally. There has to be something there, right? There has to be a reason why those numbers aren't going up nationally. There are, of course, certain players that are doing a much better job than others, that are increasing adoption, that are really driving this change. But if we can improve our understanding, adjust those metrics into something that actually is reflective of value driving change rather than simply checking a box, then we can help people get the kind of care that they want and help health systems and payers do better and comply better.
And Jared, if I could maybe
yeah.
just build on this notion of partnership. So let me give you a little bit of a early teaser. So as the data shows, we know the Medicare Advantage chassis tends to support more individuals from underserved communities. If you look at the 65 million plus Medicare beneficiaries, the 45% or so enrolled in MA have a higher distribution amongst the underserved populations. There is good news to be said. Minorities in particular are actually engaging in advanced care planning in higher numbers than those who remained in the fee-for-service program. So there is some evidence to suggest that the MA plans do route individuals to these sorts of high-value conversations. Similarly, of those who stay in the Medicare fee-for-service program, if you're lucky enough to be enrolled in a Medicare ACO, or attributed, I guess technically you don't actively enroll, you are attributed based on your relationship with your primary care doctor, there also we see higher rates of advanced care planning because that is part and parcel of the strategy to create that coordinated care relationship. You almost want to get that baseline understanding of the family's goals and objectives. And so that is comforting. We work together to help discover some of those baseline statistics. And as Tatiana alluded, part of the goal is to kind of dig into where we see rates of improvement growing faster because they've figured out a best practice, or challenges that we might want to identify for maybe what we would call non-tariff trade barriers in policy circles, in case there's reasons people are not getting access to this service despite it being covered as a benefit in Medicare.
Yeah, absolutely. Just to tag a little bit onto that, I think one of the reasons we're seeing some of these major differences between fee-for-service and value-based programs in terms of advanced care planning efficacy is exactly what you mentioned: managed care and coordinated care. Right? The ability to go beyond the checkbox of a billing code to ensure that quality conversations are taking place. That's what truly drives not only savings, but impactful change for families and patients. If we are able to understand and build and measure a process that promotes a more thoughtful planning experience amongst patients and their loved ones, I think we will be able to use other components or use other metrics as a proxy for the quality of those conversations and the actual change we want to see. Because at the end of the day, it does benefit absolutely everybody at the table, and it's a wide open space.
Thank you both so much for those additions. And this is why I like talking with both of you, because the conversation flows so well, because you just keep going off of what the other person says and back and forth. And it's really great to see both of you speak and get excited about this partnership. The last thing I want to quickly go over, or have you both go over with me and our audience, is every partnership has layers to it. Can you talk about kind of the next steps in this partnership? And either one of you can start.
In my mind, I always think in threes, just the nature. So we started with some shared knowledge and we collaborated to help shine light. Maybe we'll continue to iterate on that. But another is, as luck would have it, many of the CareJourney members, we have about 150 of them, some of the leading value-based care networks in the country, are also beginning to learn or work with Koda. And so there's a 1 and 1 equals 3 opportunity, which is the next layer of the onion. How might we better track what high performance use of advanced care planning, maybe with Koda's feedback on where we can demonstrate the value to families, to the networks themselves, that maybe the second layer of the cake. And then really, I always have a dream aspirational third layer of the cake. We don't know when we'll get there, but I believe in a new class of healthcare company that's referred to as a health information fiduciary. And in that class, the premise is whether you are extensively required to do it by contract or by other means, philosophically, the work you do should be in the best interest of the patient, period. And I want, ideally, a magical digital, call it guardian angel, that could whisper in my mom and dad's ear, now's the right time for you to have this advanced care planning conversation, and to initiate the very service that is otherwise available, maybe has some outreach attached to it. But in my dream world, maybe you call it the Harry Potter sorting hat. Everyone that is eligible for and would benefit from the service should be put into the right house where they get access to it and they can utilize the services to the way their families need it. So whether that actually is an aspirational part of the relationship or we operationalize it in some way, that's to be determined. Take your take on it, Tatiana.
I mean, I couldn't have said it better myself. I think it's a marriage of people and data, and without the two working together, you don't necessarily have insight into the other side of the equation, right? Data swimming on its own can be incredibly value add, but it provides so much more clarity when you have sort of a boots on the ground understanding in terms of how to make these processes more efficient. What is actually reflective of a high quality conversation? When is a good time to whisper in your parent's ear, right? Having that understanding informs the data. And on our end, being able to create these experiences for patients and being able to understand their journey, at the end of the day, that journey is still impacted by utilization, care plans, it's by physician burden, by all of the data that you guys process and understand and make understandable for others.
Well, as always, super excited to chat with both of you. I know we're going to have you on again soon. Just it's what seems to happen, right? Because you two, magic happens when you start talking about this partnership. So maybe eventually we'll have you come on to talk about maybe some of the findings of the partnership and what that looks like, or the additional layers. But something tells me both of you will continuously have some big announcements that continue to come up. So it could also be for that. Wish you both all the best of luck. Can't wait to continue to follow the partnership and the progress of both companies. And thanks so much for coming on the podcast today.